Welcome to Alpha Bites, where we serve up bite-sized insights to help you grow your business and your bank account. Our host, Alex Zinni, CEO of Alpha Key Digital, dives into the latest marketing trends, proven strategies, and actionable tips to scale your online presence. Whether you're a seasoned entrepreneur or just starting out, Alpha Bites delivers the keys to unlocking your success. Now, let's get started with the show.
Hi, everybody. I'm Alex Zinni, your host of Alpha Bites, where I sit down with inspiring business leaders and entrepreneurs to dive into what drives them and uncover the secrets behind their success. In our first season, we featured incredible guests like Dr. John Paul Stevens, Dr. Martina Moore, and Dr. Kara Ogren of Synergy Physical Therapy. And there's many more to come, so stay tuned for future episodes packed with insights and inspiration. But first, this episode is brought to you by Alpha Key Digital. Based in the vibrant heart of Northeast Ohio, Alpha Key Digital specializes in delivering revenue-generating digital marketing solutions tailored for plastic surgeons, dermatologists, mental health professionals, and any other private practice looking to grow their patient base. From cutting-edge AI, SEO, and social media strategies to high-performing websites and pay-per-click campaigns, our expert team is dedicated to driving measurable results to elevate your brand. To unlock your business's full potential, visit us at alphakeydigital.com to book an introductory call with Madison Hewitt. So before we start today, I want to give a special shout out to Dr. Paul Vanek, who will soon be a guest on this show and who introduced me to today's guest. Be sure to check out his practice at mentorplasticsurgery.com to learn more about his incredible work. Now let's dive into today's episode. I'm thrilled to welcome Casi Vician Ischay, a dynamic leader in healthcare informatics. As the CEO of Clinical Informatics Company, Casi is a trusted consultant in healthcare and IT process automation. Renowned for her expertise in strategic roadmaps and scalable solutions, she excels at tackling complex challenges through thought leadership and collaboration. With a remarkable ability to bridge technical and clinical communication, Casi drives innovation while mentoring teams to deliver exceptional results. Welcome to the show, Casi.
Hi, Alex. Thanks for having me.
Absolutely. So glad you could make it on the show today. But I just want to dive right into it. What inspired you to pursue a career in healthcare informatics?
It's kind of a funny story that was not at all deliberate. When I was a child and a teenager and into my young adult years, my parents had kind of a combination of healthcare and IT. My father was a computer systems analyst, and my mom had a transcription company, medical transcription. And so by proxy, again, not intentional, I kind of was forced to learn computers, and everything I did, my school homework and everything else was on computers way before kids were doing that. And my mom has always been in healthcare and nursing homes and the transcription. So when I had my first child, I kind of learned the medical terminology and then got a degree in clinical psychology myself. And it just made sense. Growing up with computers in front of you, all things IT and coding and making difficult processes less difficult with computers just made sense to me as a clinician myself. So as it evolved over the years, I just want to help others do the same.
Wow. Yeah, that's a great story. And it started young for you. So for those who might not be familiar, what exactly is healthcare informatics?
Well, informatics, as you can imagine, can be in any industry. And so we at Lucas Health Tech, we do focus on healthcare, but it's really any industry. And we specialize in what's called RPA, or robotic process automation. And being in this world of AI, it's a train that's moving faster than almost anyone can get on. And I have a hard time keeping up with it. But essentially, as a clinician, I was bogged down with my own paperwork, seeing patients in a caseload during the day and having to do all this tedious paperwork later on in the day. It's just too much. So I developed my own automated processes, if you will, back in the day. And then as AI and RPA evolved, it just makes sense. So imagine, if you will, anything your hands can do on a computer and your eyes can see on a computer, we can automate So whether it's going to a website and copying and pasting into an Excel spreadsheet and then sending that spreadsheet to email and then automatically processing and receiving those emails, it can all be automated so that a bot, if you will, I like to call them digital workers, they can process that information automatically for you. And it can be done real time. It can be done once an hour. It can be done once a day. And it really just removes the overhead and the administrative burden that really burns clinicians out. So it's instant ROI and frees up so much time for people to do more meaningful work that they've been trained to do. It's very passionate and it's really wonderful and truly applicable across any industry, not even just healthcare.
Yeah. That's fantastic. And ROI is something that I think a lot of people are going to focus on. What's an example of an implementation that you've done that you saw that really just made a huge difference?
Sure. We've done so many projects. I have developers onshore, nearshore, and offshore who are just phenomenal in the field and just geniuses in their area. And so any project we pick up, we look at use cases. We looked at Blue Cross Blue Shield of one of the big states and found over 200 use cases where it could be applied. And for example, if you just do the simple math on it, how many people are doing this repetitive work per hour, per day, per year? And then you just break that down by how much are you paying that full-time employee hourly or annual salary? And of those, sometimes a call center, for example, maybe doing the same repetitive work for 4 or 6 hours a day. And it's something that doesn't need human thought or it's just people are doing it with their hands and their eyes because that's what they do. You need people doing that. So if you just do the quick math on what you're paying folks to do stuff that they're highly trained individuals that are doing, and you just do the math of what it would cost to implement some RPA, and there is the upfront cost, of course, getting in and understanding the use case and click by click what they're doing. But once it's up and running, the math is very simple. And our goal is rarely to eliminate FTEs. We're not here to replace humans. I think that's a misnomer that people really misunderstand frequently. We're there to let them do more important work that will ultimately benefit patients and members and people down the line who need their expertise and their training. So the return, sometimes people are eliminated. You can cut some overhead. That's unfortunate, but if you need to look at dollars and numbers, it is a solution. But also, we also offer getting in and having a fresh set of eyes, evaluate the informatics and all the systems that folks have in their either one doctor office or multiple physician offices, or really, again, any industry, just to make sure you're receiving the best out of the technology you've invested in, and kind of revamping everything, making sure the folks in your office have the very best training that they need to do their job effectively. We also look at billing and make sure that reimbursements are in place. We have a billing company we work closely with. So just kind of a full suite of solutions, but we really focus highly on that RPA because literally everybody can use it.
Yeah, it sounds like it's so beneficial and there's so many different ways that you can go. So how do you sit down and create an approach, like a strategic roadmap for your clients? Where do you begin?
Conversations with like high level, explaining like I am right now, what is RPA and robots? You think robotic medicine. It's nothing like that. There's no physical robots. It's literally, it's just code. So it's just code that in the background. There's nothing intelligent. It's not going to break anything. It's going to do exactly what you tell it to do. If it gets confused, it just stops. The process stops and gives you an error report. So we go in, and once the folks have a general concept of what RPA is and how you might be able to benefit, then we sit down and, we may start with an administrator or a department head. For example, security is always kind of tight, and healthcare systems get nervous about the security about it. So sometimes I go in and I automate the security department. So let's talk about the mundane processes that you're doing every day. And they're like, well, I've got all these logs, all these clicks and everything else. And once we sit and we say, show me system by system, what systems are you using? This computer system, this website, Excel, smart sheets, email, and how they're all integrated. And I show them, okay, if those are just clicks and copies and pastes and things you do every day, guess what? The bot can do that for you. The digital worker can do that for you. And we create these use cases, and then we record the session in a similar setting like this. And then click by click, we literally duplicate the process. We put that back in front of that's me or that expert user, and we make sure that they know that you're going to be a hand-in-hand partner with us through the whole process, so that we're not going to do anything. We're not going to implement anything until you've signed off and said, yes, that's exactly the process. You've got it right. And then we create the code for that and we implement it into their systems. You basically create a digital worker login, just like you would any other employee, that has the exact same access that the employee would, nothing more, nothing less. And then we press play however frequently they want it to be run. And then it's in their test environment, not affecting anything negatively. And once it's run side by side and you see that it's exactly what the human would have done, and it's done so fast, and then you sit back, they're like, whoa, when we demonstrate it, it's really fun to watch people's faces because we're like, watch closely. And it's like, it just did that whole process. They're like, what? So it's really fun. I'm super passionate about it because truly the sky's the limit. And even when human decisioning is necessary, where there's like, well, in some circumstances, you may have to go to this site or, pull in that information, the digital worker can pause and then hand it off to, say, send it to a file or an email, and the human can pick it up and work that piece of it where human decisioning is necessary, and then put it back, and then the process can pick back up and finish it. So it's just a limitless world of possibility, and it's really fun, honestly, to just go in, and once you roll out one process, it's like fire. It sells itself, because they're like, do you think you could automate this? And what about this? Claims and prior authorizations and reporting, and way above and better than SQL. People get pretty excited pretty quickly.
Yeah, it's like you said, the sky's the limit, and the amount of applications is incredible. And I know there's so many things that I want to automate myself too, and it's having someone guide you on how to do that is so valuable. So how did you come up with the idea, Casi, to start this company and go into this very new and innovative field?
I've been in so many different areas of healthcare over the years. I've implemented an electronic health record for, you may be familiar with, University Hospitals here in Cleveland. So I was part of the team that took that paper chart out of physicians' hands and handed them instead a computer. So I've been in the business of change and innovation for over 25 years. I'm dating myself a little bit. And then this has just evolved. As soon as you drive a brand new car off the lot, there's a better one, and it's a little obsolete. And that's how computer systems are. So being in the world of just informatics and healthcare for so long, it certainly wasn't my idea. I was a consultant that was brought in with a company based out of St. Louis. And it was a new concept to me, but it's not a difficult concept to understand. And RPA itself is pretty cut and dry. It's actually quite simple. You just bring in the right vendor to work with to run everything in the background. And you bring in a team like I have of phenomenal, genius developers. You learn the process, you hand it to them, you run it back past the users, and off you go. So it was just an opportunity that was brought to me as a consultant, and I learned about it. I said, yeah, let's look at this. And it's just been very rewarding ever since.
Yeah, it sounds like it, and it takes a tremendous amount of creativity. How do you channel your creativity, or is it something that comes natural to you, or is it a skill you've developed over the years?
I think a little bit of a combination of all, honestly. So When we first introduced this, rarely do clients in either it's a large health system like Blue Cross Blue Shield, where there's 6,000 employees, or a smaller, literally one single physician with a staff of 10 to 20 people. Everybody can use automation. So usually walking in the door, they don't have a concept of it, and so we want to introduce a proof of concept. So I just have casual conversations with maybe the office manager, or as I mentioned, departmental heads, just somebody who can grasp the concept and kind of be an internal cheerleader. And then I'll look for that kind of no-brainer, low-hanging fruit, quick and easy win. So we go for high return, low complexity with any processes that are very black and white. And once I hone in on that, I sit down and I'm like, let's really talk about this one. And they'll say, well, this is what I do. I set up new users all day. I go in and I click this. I copy and paste the script. I put it into an email. I send that out. I change the help desk ticket. It comes back. I go back and I'm like, yep, there it is. There's the low-hanging fruit. So once that's identified, which takes a very experienced eye to find, you say, that's my low-hanging fruit. That's quick and easy, high return win. That's our proof of concept. We automate that one. Very simple. We don't make it as more complex than it has to be. We can make extraordinarily complex processes. We can really, there's no limit. So imagine processes that could take an hour even for one process. So we do those quick and easy wins with a high return, a high volume. We stand that one up. And once that's in place, they're comfortable with that. The audit reports of returns is showing success. Then that creativity comes in. Well, it's kind of like pulling teeth at first, and you really have to know the questions to ask and the people to talk to. And once you can kind of spot those, then you start creating, we create the use cases, and then we plug into this gigantic formula that spits out returns and complexities, and it's just numbers at that point. It kind of weeds out based on the processes and the systems themselves. And it shows you on paper what your return is going to be, your NPV for 3 or 5 years. And then it just becomes timing and budget.
So with that in mind, what's one of the proudest or kind of like a cornerstone achievement that you've seen that you were like, wow, this is really amazing? Is there any specific project or anything you can look back to?
Yes, without getting into proprietary ownership of actual hospital systems, we did work for a hospital system in Minnesota, and believe it or not, it wasn't even a functional patient-facing process. It was a teaching university hospital. So they had all these residents coming in, and there's incredible amount of work that needed to be done with the licensing and their vaccines, the physicians or residents' vaccines and paperwork. So it was one woman's full-time job to just take care of and maintain all the different stages of these residents' vaccines that they had to have to be a physician. And it was ridiculously time-consuming. Well, then we rolled that out to a system of 6 or 7 other hospital systems who were also teaching systems. And so it just flourished. And that one replicable, reusable code, one system kind of fronted it, and then we tweaked it for others. It just grew like wildfire because everybody needed it. Anyone who's a teaching hospital with residents coming through could benefit from it. So that's kind of another avenue. You talk about creativity, where we may find one process that hundreds or thousands of other people are doing, and we stand it up in one health system. And it may be something as easy as verifying phone numbers at a call center. If you get a bad phone number and nobody answers, that's still a human's time having to document, oh, it was a bad phone number. How many call centers are there in so many industries around the world? So things like that I'm pretty proud of those that we've automated and just resold, if you will. So it's a fun thing to be a part of. And I love when I see that little glimmer. I'm like, ooh, there it is. Let's talk about this. You're gonna love this.
That's awesome. And that is quite an accomplishment too. Definitely a complex challenge solved. What
Mhm.
advice would you give to leaders who are looking to kind of scale their healthcare, IT operations, with these types of services?
Well, I love that you use the word scale too, because that's frequently exactly what we do. We start out with that proof of concept that maybe just one department. And as you can imagine, healthcare systems, or really any industry, have that cross functionality where claims and error and everything, so many different systems cross into so many other systems. So when I speak with the C-suite leaders and stakeholders, I ask them to think way outside the box. So it's not just call centers who could benefit from a little bit of automation, cutting down 1 or 2 or 4 hours per day times 25 people on calls. Think about your billing processes. Think about finance, security, reporting, everything. And let's scale this concept. And all of a sudden, you've got that list of 200 or 300 different use cases that you have to now start breaking out into individual roadmaps. And it becomes a year-long process. And as you stand them up, it's just mad accolades, and then they roll over to managed services. But really, once it's gone into place, it kind of runs itself. So it's really fun. So those leaders, I would just think about who can benefit. Think about, I hate to say it, but think about yourself. Like, what do you do every day that is really annoying and tedious? And, talk to me about that. And once they're like, okay, if you could make this happen automatically, I would love you. And then sometimes we can't, but usually we can. And then we put that in place. They're like, all right, well, you got to talk to so-and-so, and I got to bring so-and-so and so-and-so to the next call. And before you know it, everyone's standing in line.
Yeah, that makes a lot of sense, and it's something that is the future. What do you see that's really exciting you now that's going to come in 2025 and beyond? Advancements that are exciting to you.
I can barely keep up with it, if I'm honest, Alex. I'm constantly reading the Becker's reports that come in my inbox every day, and I'm scanning through. What's exciting to me as an individual that I'm looking at, not right this minute, but maybe down the road, is how corporations are starting to realize, and whole healthcare systems especially, are starting to realize that in addition to their current C-suite of CIOs, CMOs, CFOs, CEOs, the typical CEO suite, they're starting to realize that now we need a CAIO, a chief artificial intelligence officer who understands the industry and who can keep up with the industry and who can delegate and build the teams to best serve their organization internally, because it's a real thing. I know there's a lot of uncertainty with it, and with uncertainty and change comes fear, but it's not something that can be ignored, because AI is here whether we want it, you want to embrace it, or you don't. And it's interesting to see, because a lot of organizations want to be on the forefront. And we automated for Tahoe Forest in Montana, way out on the West Coast. They just wanted to say they had this shiny, cool toy that is automation. And, it was fun to do some great things. We saved them a lot of money, but it was just kind of like, haha, we got here first. But it's really either get on this train or get run over by it. And I think it's exciting how it's even being built into the C-suite, because people are starting to really recognize that it's a need for their organizations. And I see that growing immensely this year.
I totally 100% agree with you. So before I ask my last question, Casey, I want to point people to your website and where they can learn more information about you. So where would you want people to go visit to find more information out about you?
It is Lucas, Lucas, named after my eldest son, Lucas, Health Tech, HEALTH Tech.com.
Awesome. Well, make sure that you go visit that website, everybody listening, to learn more about Casey and her amazing team. I have personal experience with Casey, and she's awesome, very intelligent, and very much bringing a game to a very new and rapidly evolving field. So for the last question, Casey, what is some of the best advice that you've received personally, professionally throughout the years that you've really carried with you into your life?
Work with what you have. A lot of times people don't know how to get started, whether it's, I've run a couple marathons. I've been a gym rat. I've done a lot of weird things. I've learned how to play the bass in the past 4 years. Get started somewhere. Don't be daunted. Don't think it's not something, it's not for me, or I'm not sure. Just jump in. Life is too short. Time is too valuable. Just take your left big toe and put it in, and then follow with your whole right foot, and just dive into whatever interests you, and do it today. Today is a great day to do that thing.
I love that. That is such amazing advice and a great high note to end the conversation. So, everybody listening, thank you, Casey, for being on. It's been a real pleasure talking to you, and we'll talk to you soon.
Thank you so much, Alex.
Thanks for tuning in to this episode of Alpha Bites. If you found today's insights valuable, be sure to subscribe, leave a review, and share the podcast with your network. Let's keep the conversation going. Connect with us on social media or visit us at alphakeydigital.com/alphabytes. Remember, the keys to your digital success are just a bite away. See you next time.